Hello everyone, welcome to The Social Doctor, and this is Dr. Ayushi. The Social Doctor is a platform for the doctors by the doctors, where we discuss journeys, experiences, and knowledge from successful medical practitioners. And today we have a very special guest, Dr. Vijay Kumar, a very established geriatric medicine consultant here in the city of New Delhi. And he's a senior consultant as well as an HOD in the Primus multi-speciality hospital, Chanakipuri. And he's here to discuss about the scope and opportunities of geriatric medicine, a branch which is very less spoken about, a branch which needs much more attention than it is actually given to. So he's here to discuss everything about it. And in case you have any questions related to that, please let us know. We'll definitely put them up in the discussion today. So welcome, Doctor, to the platform. It's really nice to have you here.
Thank you, Dr. Aisu, for this wonderful initiative. And actually, our branch need this more and more to speak, because even medicos are not aware about this new specialty.
So, and actually, sir, it's so new ki kafi recently that especially the older people do not understand ki kya hai, kya aise hai. So that is the reason we believe it should start. It should actually be discussed.
Maybe due to its name, like geriatric, so some people spell it like genetic.
Yes.
थोड़ा सा सीनियर सिटीजन स्पेशलिस्ट अगर बोले तो फिर भी समझ आ जाता है लोगों को. If you say that it's geriatric medicine, so then we explain it by that like pediatric, we are geriatric. So
yeah, now now when you explain it this way, tab zyada easy ho jata hai logon ke liye, definitely. So sir, let's start with your journey first. Understanding ki sir, how did you plan to get into a geriatric medicine, something which is so new? What made you attract towards this branch, and how did you get into it?
In 2012, it was started in AIIMS, New Delhi. In January 2012, the first session, I got admission into July session.
Okay.
So there were two seniors to me only, and there was not very much knowledge, and scope was discussed about this even on internet and everything. So when I got this branch, then I had various other options also, but frankly I chosen this like that it's like medicine, and I will have a stethoscope and I will be able to see the patients. Like that was the main thing. After that, all this this branch has grown up, and we had a ward, and now National Center for Aging is coming in AIIMS New Delhi. So अभी मतलब काफी बहुत प्रोग्रेस हो गया है तब से अब तक 2012 से, और अभी 10 years में मतलब काफी इसमें. हाँ, डॉक्टर डे AB डे जो है हमारे HOD के सर, तो उन्होंने मतलब अपनी लाइफ जो है जेरियाट्रिक मेडिसिन को दी है उन्होंने बेसिकली. तो he was प्रोफेसर इन मेडिसिन.
अच्छा, and he focused on geriatric.
हाँ जी, उन्होंने फोकस्ड ऑन जेरियाट्रिक मेडिसिन. तो उन्होंने एक क्लिनिक से शुरू किया कि आफ्टरनून क्लिनिक को जेरियाट्रिक के लिए, and then मतलब धीरे धीरे he established a department. Then government or policy makers को he convinced for a center for aging, that it's like tsunami, silver tsunami, you can say. That we are happy that we are young India, but this young India will grow old also.
Definitely.
So we should be prepared for it. And age-related diseases, age-related problems, we should be prepared. Our society should be prepared.
Yes. Definitely. And actually, this is something which is very less spoken about in India, because maybe of the family ecosystem and everything. But actually, the old age people need to get focused and need to get that attention that is not being given in our society. So this is much more needed. Or you have been the first timers and the in the first timers of the geriatric medicine, and so I'm sure कि आपने तो पूरा you have seen how it is evolving, what are the opportunities opening up, and that will be great to discuss further.
Yeah, opportunities are huge. Like there is huge clientage available, so there is no dearth of opportunity. There are huge opportunities. Correct. Even in metro cities and other cities also. You can see second and third tier cities also, because there is huge population which need to be catered, which need to be cared. So and we will fail if we are not able to develop so many geriatricians to cater them to. Correct. So we have to train the family physicians also, and MBBS, like in our health system, we have to train them also. So like we have to be a holistic care we have to provide, and we have to train our physicians, MBBS students also, because from there we can build a this geriatric medicine concept we have to build in them.
No,
So
you are absolutely right.
AIIMS Delhi is offering geriatric medicine, and AIIMS Rishikesh has started it. CMC Vellore, Amrita Institute में भी है नीचे जो साउथ की बात कर कोची में. Madras Medical College, one of the oldest, जो है वहाँ से geriatric medicine actually शुरू हुआ था ये basically इंडिया में. तो अभी जिपमर में भी they have introduced one of our colleague is faculty there, Vinu Gopalan. So private में भी अभी जो है धीरे धीरे it's opening up, and बनारस हिंदू यूनिवर्सिटी जो है BHU, वहाँ पे भी डिपार्टमेंट एस्टेब्लिश हो गया है. And SMS Jaipur में there are our colleagues who have established this department there also. And in Rajasthan, like Bikaner, maybe there is geriatric medicine. Ajmer mein they have advertised. So even PGI Chandigarh mein, the center has been approved. So maybe next director or something. So they will be establishing a center there also. And CMs Ludhiana, maybe they are planning to start. So it's opening up, and people are, जैसे डिमांड होता है तो लोगों को फिर वो प्रोडक्ट जो है मार्केट में मतलब
लोग उसको ऑप्ट करते हैं. डेफिनेटली.
जैसे ही लोग अवेयर होंगे, मेन अपना पर्पज है कि लोगों को अवेयर करें कि दे नीड स्पेशल केयर, दे नीड स्पेशल physicians who are geriatricians. So we if this population, because they are voters also, they will develop the ways to promote this. Correct.
No, this is, and this as you know, जैसे आप as you said कि pediatrician बच्चों के लिए करता है, तो old age के लिए भी geriatricians are important, and it's glad कि इतने सारे जगह पे खुल रहा है geriatric medicine department, so that people can actually pursue and understand the importance of it also, and then the layman will also understand कि ठीक है, अगर old age में problem होती है, किसके पास जाना है, जिस तरीके से holistic आपको approach मिल सके. So now with coming to this, as you mentioned कि अलग अलग जगह होता है और आप pursue कर सकते हैं, इसमें बहुत सारी opportunities हैं. But as you are settled in a metro in Delhi, and you have been there since start, what I understand. So how is it different than being there? Because Delhi has much more competition, much more, crowd, and people are also very different in attitude than a smaller city. So if a person, if there is a student who is pursuing geriatric medicine right now and is planning to settle down, what is your suggestion for that student? Ki kahan, and he's open to going anywhere. So what is your suggestion to them? कौन सा बेटर जगह है सेटल डाउन होने के लिए?
Thank you, Dr. Aishu, for asking this question particularly, because if you can take the example of our and juniors, then
Hmm.
you can totally understand the scope of this geriatric medicine.
Correct.
One of my
Correct.
senior, who is the first batch, one of them is settled in Jharkhand. One of them is in UK.
Acha. Acha.
Second batch, me and my colleague Dr. Ramesh Kandel, who
Hmm.
sponsored it. He is in Nepal. He is the
Acha.
head of department
Hmm.
there. And
Hmm.
I was in AIIMS, and now I am in corporate sector.
Hmm.
So after that, Dr. Gaurav Desai, he is in UK.
Hmm.
Dr. Harjeet is in corporate sector. So likewise, he is in JIPMER
Acha. Hmm.
faculty there. He is faculty there. Dr. Rishabh Bansal in Jaipur,
Acha.
Durlabji Hospital.
Hmm.
Dr. Sunny Singhal, faculty in SMS Jaipur.
Hmm.
So, and Dr. Kamal Bandhu, he is in Bihar.
Hmm.
He is practicing in Patna and other smaller cities.
Hmm.
So there is huge scope, because most of the people are who are in the they fall in this our age group 60 plus we take.
Hmm.
So if even if you want to settle in a smaller city, you can easily get settled there.
Hmm.
If you want to get settled in
Metro.
metro cities,
Hmm.
it's your unique, it's your USP that you will deal with direct. So main funda is to spread the our Dr. Prem, he is in Jaslok Hospital,
Hmm.
and
Hmm.
Dr.
Yeah.
Srinivas, he is in Mumbai and Pune, he is practicing there.
Hmm.
So जितने भी लोग अभी तक जेनेटिक मेडिसिन से एसोसिएट हुए हैं, दे आर डूइंग गुड, एंड एक आपको वैरायटी दिखेगी, मतलब कोई बंदा बिल्कुल एक छोटे से शहर में जाके भी ही इज प्रैक्टिसिंग वेल। तो
Hmm.
अगर आपका मतलब हर बंदे का एक अलग रहता है कि मुझे जो है एक छोटे सिटी में जाके अपने होम टाउन में जाके सेटल होना है, तो ही कैन
Hmm.
गेट इजीली गेट सेटल देयर। और किसी को
Definitely.
ये है कि मुझे किसी मतलब बाहर जाना है, यूके जाना है, यूएस, वो भी आपके लिए ऑप्शंस जो हैं
Open.
मतलब खुल जाते हैं बहुत सारे
करेक्ट
इस समय।
करेक्ट करेक्ट। एक और चीज आई वांट टू आस्क इज कि क्योंकि काफी न्यू ब्रांच है, इट इज अ वेरी न्यू ब्रांच, सो एनी ब्रांच व्हिच इज न्यू, उसके एक एडवांटेज एक डिसएडवांटेज होता है। फर्स्ट एडवांटेज इज बिकॉज कंपटीशन नहीं है, so you are able to establish yourself well in that area of yours, and you tend to make your space better than the other branches, because then there is a lot of competition there. Secondly, awareness, building that awareness in the old age right now, because इतना मे बी स्मॉलर सिटीज में इतनी अवेयरनेस नहीं होगी कि भाई ये जीरेटिक मेडिसिन वाला ही है, और क्योंकि मैं 60 प्लस हूँ तो मुझे इसी के पास जाना है, दे विल मे बी गो टू अ फिजिशियन ऑल्सो, और मे बी एनीबडी, अ क्लोजेस्ट डॉक्टर मे बी. So how is it that what are your ways to deal with that, and how do you manage this?
देखिए, जब आप न्यू होते हैं, मतलब आपके फील्ड में जो है, तो जो सबसे पहले आगे चलते हैं उनके लिए थोड़ा सा रास्ता जो है मुश्किल होता है।
बिल्कुल।
बट जो हमारे डॉक्टर डे ने किया है, सर ने किया है, तो वो he has established a path for us. After that, Dr. Prasun Chatterjee is there. He is now nominated and selected as a advisor for healthy aging decade for in WHO. So जैसा आपने बोला कि जब आप न्यू फील्ड में होते हैं तो आपको he is very young, he is additional professor and he has been selected as WHO advisor. So इस एज में उस पोजीशन पे पहुंचना किसी दूसरे सब्जेक्ट में मुश्किल होता है। So
because ये ब्रांच नहीं है, so he is able to actually reach to that stage. Definitely.
So but they have made realize to the policymakers that it's the requirement, it's the need of the hour, and we have to take cognizance of it. We can't ignore our aging population. We have to be prepared. We need to prepare our society for this. So इश्यूज होते हैं जैसे नए उसमें कि आपको जो है कि सिटी में जाएंगे तो वहाँ लोगों का अवेयरनेस नहीं है, कंपटीशन रहता है। क्योंकि बड़े हॉस्पिटल में भी आप जाएंगे तो वहाँ पे जो फिजिशियंस हैं, जो जो बेसिकली इन कंपटीशन उनसे ही रहता है,
बिल्कुल।
तो वो एक रहता है। बट वही है कि कंपटीशन तो आपको फेस करना ही होगा, एंड यू हैव टू वर्क फॉर इट।
डेफिनेटली
जो अच्छा होगा, पीपल विल चूज हिम।
यस यस, वो तो एक जनरल सी चीज है। एक और चीज इसमें, हाउ इज द काइंड ऑफ प्रैक्टिस यू हैव बीन वर्किंग इन एम्स, और अभी आप एक मल्टी स्पेशलिटी जगह पे काम कर रहे हो, बट if somebody wants to set up a private practice in itself, is it possible? Because as a, you know, as an old age, it needs a lot of things. It's not just, you know, medicine, it's also sometimes physiotherapy, sometimes, you know, some, and lot of, I'm sure you understand, lot of small things as a holistic approach. So what is your suggestion to those? Is private practice possible in this branch?
Yes, it's very much possible, and it's very physiotherapy is our most important thing in our patients. So we can have setup of, like, it's a holistic approach for elderly. That's why it's different from the simple medicine. We say that's why they need special care. Like we have to take care of their diet, their physiotherapy, their basically their daily activities of life. Functionality is the most important thing which we have to take care, and we take care of it. And most of the symptoms which people feel, even patients, they ignore that it's race related, like urinary incontinence, like memory problems, and there is huge scope of intervention. We can intervene. If we can intervene early, then we can like slow down the progression of those things, and we can improve their quality of life. So like Dr. Kamal Bandhu, one of our juniors, he has established a private practice, and Dr. Srinivas, he is also in this private practice. So they have established it independently, like with the physiotherapy setup, dietitian, and psychologist is also very important in our field. So they have, because we have to see it, the patient in holistic approach. Correct. And we need to identify the problems, then find out the solution for them. So ये बहुत अच्छा रिजल्ट भी देती है अगर आप मतलब उसमें
completely, you know, take care of it. Definitely, this is much needed, and I'm having a opportunity of private setup is best. You know, you can also make your own space. So now when understanding ki how can you establish yourself in India, everywhere it is so much opportunities, as well as you mentioned internationally. तो internationally sir, जैसे आपने बोला कि आपके सीनियर्स यूके में हैं या बहुत अलग अलग जगह सेटल्ड हैं, क्या अपॉर्चुनिटीज है अगर इफ समबडी प्लान्स टू गो आउटसाइड आफ्टर you know, after doing the masters in the geriatric medicine, how is it, and is it actually worth to go outside? Is also something
what to go outside, तो मतलब ये
पर्सनल, ठीक है, पर्सनल चॉइस है वो, ठीक
है हर किसी का। बट ये है कि you have option, you can, if you want, you can pursue like you can appear for MRCP, and you can, there are various fellowships available, you can opt for that. And सिंगापुर में बहुत से जेरेट्रिशियंस हैं जो इंडिया से गए हैं, तो यूके में भी बहुत से ऐसे लोग हैं। तो वो सब, हमारा एक जूनियर डॉक्टर सुमिताभ सिंह, ही इज इन यूएसए। सो तो मतलब उसमें आपके पास कोई रेस्ट्रिक्शन नहीं है, मतलब एक बहुत से ऑप्शंस आपके खुल जाते हैं। मतलब ये जो मतलब क्लोज डोर्स नहीं है, मतलब बहुत ही अच्छी वो है, एक बार आप इस, हाँ जी,
करेक्ट। इसके अलावा सर, व्हाट Are there any kind of specialization, super specializations in this branch? Something which is, if any, तो अगर आप mention कर सको.
यस अभी टाटा इंस्टीट्यूट्स जो हैं उन्होंने फेलोशिप स्टार्ट किया है. दे हैव स्टार्टेड फेलोशिप इन जेनेटिक ओंकोलॉजी. One of our junior is has been selected there and he's pursuing it, Dr. Abhijit. So and there is a geriatric rheumatology fellowship in BHU. They have started this. And for the super specialty, it's in the pipeline. We will, because this National Center for Aging, it has been built for this purpose only, that for the capacity building and for these, for human resources. We have to, we will have training in nursing also, geriatric nursing. And super specialty for like geriatric cardiology, and ये सब भी अभी आगे फ्यूचर में आएगा जब लोग होंगे, they will like
pursue this
अभी
also.
हाँ हाँ जी, अभी their geriatricians ही कम है, तो अभी धीरे धीरे they will like जो भी ब्रांच एक बार नई, जैसे इवन पेडियाट्रिक भी जब कभी हुई थी तो उसमें भी
धीरे धीरे हुए थे. डेफिनेटली आप बिल्कुल सही बोल रहे हो.
ओंकोलॉजी, जेनेटिक कार्डियोलॉजी, जेनेटिक एंडोक्राइनोलॉजी. डॉक्टर संजय कालरा हैं एक एंडोक्राइनोलॉजिस्ट. ही इज उससे पहले हमारे डॉक्टर विनोद कुमार, प्रोफेसर विनोद कुमार थे, वो भी एम्स से ही रिटायर्ड. वो भी जेनेटिक एंडोक्राइनोलॉजी में ऐसे ही लोगों का इंटरेस्ट डेवलप होगा. they can
actually separate. Yes, definitely. ये तो this is all about interest, what you like, and then you can get into it. Definitely. It's very nice to know. ये तो सर आप इंडिया की बात बता रहे हैं. Anything outside, if you know, there are a lot of people who have gone outside. तो बाहर कुछ ऐसा specific चीज है जो pursue करने में, you know, this place is very good to do this for super specialization.
Like बाहर में भी according to your area of interest you can apply, and there are ample of opportunities are available. It depends on your interest, that if you want to pursue like for cognitive problems, you want to pursue, or like fall clinic एक होता है, मतलब उसमें if you want to address the issues of fall in elderly. So ortho geriatrics है जो लोगों में जो गिर के जो है उनके बोन्स ओस्टियोपोरोसिस जो होती है उससे बोन्स वीक हो जाती हैं एंड दे गेट फ्रैक्चर्ड इजीली. सो उन सब को मतलब अकॉर्डिंग टू एरिया ऑफ इंटरेस्ट जो है you can branch it out and you can pursue your future there.
Definitely. No, this is and this is a fantastic thing to know, because when a new branch is coming, it's the right time to get into it, to make your space and to understand what it is. So sir, when understanding everything about this branch, what do you want to say, or to all of those students who are actually sitting for the NEET PG counseling right now and are in double mind ki geriatric lena hai nahi lena hai, you know, what, or students who have picked up geriatric and are studying right now, क्या समझाना है उनको? What is anything from your end to them?
मैं तो ये बोलता हूँ कि आप प्राइवेट प्रैक्टिस में जाना चाहते हैं, जेरियाट्रिक मेडिसिन वेरी गुड ब्रांच फॉर यू. You should select it. There is no second thought about it. कहीं मतलब आपको इश्यू नहीं होगा. आप बहुत अच्छे से, बहुत अच्छी जगह पे, जहाँ पे आप चाहेंगे यू कैन प्रैक्टिस इजीली.
करेक्ट.
आप गवर्नमेंट सेटअप में रहना चाहते हैं, एकेडमिक्स में रहना चाहते हैं, बिल्कुल इट्स वेरी गुड ऑप्शन फॉर यू, बिकॉज जो भी आप रिसर्च करोगे इट विल बी न्यू. एंड उसमें जो है एकेडमिक्स में भी यू हैव वेरी लेस कंपटीशन. सो it's a very good opportunity for you if you want to stay in academics in the और job opportunities भी आपको, जैसे मैंने बताया, इतनी जगह पे it's being started, so you can easily get the post. So you National Center for Aging चेन्नई में भी है एक जो it's ready, and दिल्ली में जो एम्स में है, एंड पीजीआई चंडीगढ़ में, ऐसे रीजनल जेरियाट्रिक सेंटर्स जो हैं आपके भोपाल में है, मतलब ऑल ओवर इंडिया जो है, इट्स इन द डिमांड, एंड with the time you will get huge opportunities.
Opportunities are coming. That's
और आप मतलब तीसरा बचता है कि आप जो है अब्रोड जाना चाहते हैं, यू वांट टू सेटल इन, सो इट्स बाहर भी आपके लिए ऑप्शन है। आप सुपर स्पेशलाइजेशन या उस तरह से अपने आप को देखते हैं कि आई वांट टू सुपर बी, सो वो भी फ्यूचर में आएगा ही आएगा, उसमें कोई डाउट नहीं है।
डेफिनेटली
ये एक डाउट रहता है कि लोगों को मन में कि पता नहीं कब आएगा, जो है मुझे तो बिकॉज जो मतलब जेरियाट्रिक मेडिसिन जो ले रहा है तो ही इज लाइक फिजिशियन माइंड, वो जैसे एमडी मेडिसिन लेगा या फिर पीडियाट्रिक्स लेगा या फिर जो है आपका जेरियाट्रिक मेडिसिन लेगा, तो उन तीनों में लोग जो है कंफ्यूज रहते हैं। तो जो जेरियाट्रिक मेडिसिन है वो मेडिसिन तो है ही है, मेडिसिन तो मेडिसिन
आपको स्पेशलाइज और कर देता है।
हाँ जी, मेडिसिन प्लस है उसमें
ओल्ड एज। यस
जी, तो बिकॉज ओल्ड एज में जो इश्यूज हैं थोड़ा कॉम्प्लिकेटेड होते हैं, इट्स नॉट वेरी सिंपल कि डायबिटीज है या सिर्फ सीएडी है या सिर्फ हाइपरटेंशन है, वो सब मिला के फिर उसके बाद बंदे को जो है इकोस्प्रिन भी देना है, उसको एंटीकोगुलेंट्स भी देने हैं, उसको ब्लीडिंग भी हो रहा है, वो सब चीजें, तो इट्स वेरी डिफिकल्ट एंड कॉम्प्लेक्स चैलेंजिंग ब्रांच है। तो जिसने भी लिया है अभी तक किसी ने रिग्रेट नहीं किया है, जितने भी हमारे साथ या हमारे जूनियर हैं।
So this is very motivating, sir. And actually, if anybody of you are in that doubt of taking geriatric medicine, you know, like sir has mentioned, it is an amazing branch with so many opportunities coming up. They are just, coming up in different parts of the country, as well as all the developed countries have more of aged populations than the young ones. So anyways, there are so much opportunities. So if you're having any confusions, just listen to Dr. Vijay and you can actually go for that branch, because this will definitely lead you to have an amazing life. So sir, now when you mentioned about this branch, in the end, we will definitely want a motivational quote or anything from your end that keeps you, on track, that keeps you motivated, and in helping people in, being what you are.
Most important thing is you get a chance to serve the elderly people, जो मतलब even in your family जो है, आपके जो भी relatives हैं उसमें भी, तो एक satisfying होता है, मतलब if you can solve a problem, you can identify actually and you can pick and you can solve the issues of these vulnerable population. तो ये बहुत ही satisfying है कि मतलब आप जो है उनकी हेल्प करते हो जो थोड़ा इग्नोर्ड है सोसाइटी में, और जो उनकी क्वालिटी ऑफ लाइफ को आप इम्प्रूव करते हो। जिन्होंने ये आपके लिए एक सोसाइटी बनाई है, आप यू आर गेटिंग अ चांस थ्रू योर प्रोफेशन टू सर्व देम।
Yes, and maybe as you mentioned, in your family, maybe some of those elderly who have taken care of you when you were young. Yes. So helping them solve their issues when they are old enough in a better way is fantastic. As well as people are aging, people are getting old, everybody needs help. And this is, as correctly said, this is the most ignored population. And very commonly in our every household, it's like, ye to budhappa aa raha hai, ye to hota rahega. Something that needs to come up, and it is a need coming up. Everybody is getting super vigilant right now with the internet coming in. All the old age people, everybody is getting vigilant. Everybody understands that there are solutions to everything, and hence geriatric medicine is, I'm sure, going to come up as a very big complete branch in every city, as he has mentioned. So if you are planning to pursue it, without double minds, do that and look forward to an amazing future with it. And in case of any confusions, any doubts, Dr. Vijay is here. You can anytime contact him. We can definitely let you know how to, and that, and clear all your confusions with that. So thank you so much, Dr. Vijay, for joining us today, for explaining about this branch, something which was needed to be discussed, especially in this time of confusions of selecting branches and understanding ki kahan jana hai and what to go for. This is something which was needed to be enlightened about. So thank you, sir, to take out time for us.
Thank you. Choose it, you will not regret it.
Yes, this is fantastic. So thank you so much, everyone, for joining with us. Do share this with all your friends and colleagues who are sitting for counseling right now, as well as with those who are sitting for NEET PG 2022 as well, because somewhere you are clear in, you make up your mind with the branches and you have that in your mind always. So this will actually help them understand how things are evolving with the current times and with what all branches are evolving now. Geriatric medicine is evolving and going to come as a very big thing in the country now, and it's better to enter now than later. So do take a wise decision for your branches, and again, in case of any doubts, any confusions, Dr. Vijay is here to clear all your doubts. Thank you so much, everyone, for joining with us. Do follow us on our Facebook and on our Instagram and YouTube channels as well. There you can find all our old videos, which can also help you in your career. Thank you, sir. Thank you, everyone, for joining. Bye-bye.